So let's sort of start. And I just should acknowledge some of the funding and people involved in this program. We've been doing this for about 5 years now. And the main funding was started with NIHR, which is, I guess, the equivalent of your NMRU, similar thing. Am I pronouncing it right? And then also from the Wellcome Trust and various other funding bodies. The really important collaborators, I would say, obviously there's my colleagues at York, but the really important people are the people at UCL who run the cohort studies in England. There's 4 or 5 amazing cohorts starting in 1948, and then every 10 or 20 years they do another cohort. So we're using, for this study, we're using the 2000, the Millennium cohort, which is going up to age 17 now. They also did a COVID sweep, and age 22 will be coming in a year or 2. So that's really quite nice and mature now, following the lives of people. And then you can patch together the life course by, going back in time to older generations. But of course, the further back you go, the less similar the cohort is and the more assumptions you have to make. And then but the great thing about microsimulation, the technique I'm using, is that you can patch in other sources of data. I mean, it's not fully causally rigorous because you're making assumptions, but we try to make the assumptions as clear as possible. We try to use the best available scientific knowledge about the causal pathways. And all I can say is we use the best data we can, we patch it together, and we explain what we're doing. Okay, so that's the basic approach. It's all open source, so that people can criticize us. Because the thing is, when you're modeling the long run, there's always going to be uncertainties. My argument is it's better to do your best with what data you have and make things explicit than just to guess, because often the human brain guesses wrong. And the biases in a policymaker's guess are even bigger than the biases in my model, right? And you don't know what they are. So at least with my model, you can tell me what you think the bias is, and then if you like, I can try and fix it, right? If you think there's a really important bias, we'll try and fix it. Okay, so that's the background, and there's some readings here. We've really only done the adulthood model properly. We're working on the childhood model now. For the evaluation, the example evaluation I'm showing you, we literally just used the real data from the Millennium cohort study, and then we patched into the adulthood. And the bottom reading is about how we measure well-being, but I won't talk about that too much because I want to talk about the way that the Treasury in the UK does it, which is a bit different. We use data on health. We use basically the ordinary health quality, and then we make a further adjustment for consumption or income. The Treasury uses life satisfaction, so I'll talk a little bit about that. Okay, so that's some readings, and there's a website with all this stuff. So I'm going to give a little overview of it. Then I'll talk about the well-being measurement and why that's important and interesting. Then I'll give a little example, and then if there's time, I can go under the bonnet a bit and show you some of how the sausage is made stuff. But let's see how far we get. Okay, so far no general questions. Okay, so the idea with this is to build a really useful engine. Forgive me, this is a child's thing from my childhood. They relaunched it, called Thomas the Tank Engine. I don't know if those of you with some English heritage or British heritage will know it. I think it's British. I think it was in Scotland as well. Yeah. Anyway, so Thomas is the really useful engine, right? He drives things around, moves things. He's useful, right? And the idea is that the microsimulation model will be really useful because it can be reused to evaluate all sorts of different childhood policies. So if someone does a trial or a quasi-experiment and they find that a policy has some short-term effect, imagine you can reduce mothers' depression levels a bit, or you give parents of young children a bit more money, or you improve a 5-year-old's social SDQ score, social problem score, or you improve their cognitive skills a bit. All sorts of trials are going on about childhood policies, and typically you get a half standard deviation improvement in some measure or other at some age or other. And that's all you know. And you could do a cost per unit of improvement, but then you can't compare. You can't compare the value for money of things across interventions in different sectors. Imagine you're in the education sector, you're improving cognitive skills or exam outcomes at age 12, or you're in the welfare ministry and you're giving more money to people or you're in the health sector and you're improving mental health or whatever, you want to compare the value for money of things, across different sectors, across different interventions at different ages, to know where you want to spend the most money, what's the best intervention, and also to target things in a better value way. So the idea is to create this engine that will enable lots of cost value for money studies to be done across sectors of promising interventions. That's the sort of vision here. And also you might be able to learn things, putting together causal inference information about the life course from different sources, putting all that together in a way as a big picture way of looking at the problem. Most academics look at one thing, one causal pathway at a time, and it's a bit compartmentalized. Sometimes it's useful to step back, look at the whole life course, and it's a framework for thinking about policy. So my argument anyway to funding bodies is that putting together all this information can give you more than the sum of the parts. There's a bit of synergy going on in big picture thinking, rather than just looking at one thing at a time. Although if you look at one thing at a time, you can be more rigorous because you can obviously laser in on it. So that's the argument against this kind of approach is, well, it's just nonsense. We don't believe any, you're making all these assumptions. We don't believe it. Go away. It's not rigorous. So that's the trade-off. There is a trade-off, but big picture thinking is never quite as rigorous. People will moan and groan about one bit of the pathway because they know all about it. So there's trade-offs in this business. So I've sort of said this already, but why do we need to do this? Firstly, it's to understand the long-term impacts of, often you get information on the short-term impacts. What about the long-term? How long does it last? That's so important about any intervention. Often you get a small effect that disappears after a few years. So obviously you have to make some assumptions about these failures. But then if you've got a model about how the natural history of a life, you can make better estimates of the fade out of policy effects. And also crucially, which kinds of children will kind of be shifted on an upward trajectory and which kinds might be less resilient. So you can get some better sense of resilience versus vulnerability. And the second thing is this crucial thing about comparing value for money across, Gunjit's creeping up. Am I doing something wrong? Thank you. So it's comparing interventions across different sectors, education, social care, and so on. And in the UK, the Treasury Finance Ministry, at the centre of everything, is getting excited by well-being as well as money. So traditionally, they focus on money outcomes, cost-benefit analysis, but they're now getting excited by the idea of looking at the well-being of the population, going back to traditional utilitarian thinking, and they measure it very simply using life satisfaction. Literally, how well is your life going? 0 to 10. 0 is very bad, almost dead. 10 is brilliant, perfect life. And literally, they just take those numbers. It's really simple. In a way, it's childishly simple, which is appropriate for childhood modeling. And they have done studies about whether a 1-point improvement in life satisfaction is more important moving from 1 to 2 versus 9 to 10. And they find roughly it's similar. So thank goodness for that. Their argument is they can just add it all up. And that's super simple. So it's a super simple approach to policy evaluation. And it's a complement to traditional financial willingness to pay measures, but it's quite a nice way of focusing on what really matters to people, which is how they experience their life. And it can give different results to how much money they have. So that's the Treasury approach. And I have yet to talk to senior Singapore policymakers about how they evaluate their policies and whether they're interested in well-being. Who knows? I'll be interested to find out. Okay, so that's that. And here is our suite. And of course, people are welcome to build their own microsimulation models, and I'd encourage some competition in this space as well as just we don't want to have a monopoly on this. But anyway, this is our suite of models. Starting with age 0 to 17 on the left, I'm not going to point this, a bit dangerous, but 0 to 17 is the Millennium Cohort study in England. In the UK. Sorry, it's the whole of the UK. And currently, as I said, 17 is the latest reported year, but it will go up to 22 in a couple of years' time. And we're in process of building that model. We've got a paper recently accepted in Lancet Public Health. There's the working paper version of that there. And that just starts, that compares 0 and 17, and it just looks, if you're born in poverty, how do your outcomes cluster at age 17? And we find that very steep social gradients in the clustered outcomes. So if you have a really bad life, when you've got, 4 or 5 serious problems, obesity, smoking, bad educational attainment, poor mental health outcomes, etc. The clustering of bad outcomes really is much more likely in the people born poor. So wealthier people are more can protect to some extent against some of these bad things. But there's gradients in all of the things, particularly educational outcomes, less in the social, in the stress, in the distress. A lot of wealthy people have distress in adolescence, but there is still a gradient, but much shallower. So that's quite interesting. But then we're going to fill in the middle, all the causal pathways in the middle, how we get to those outcomes. That's the work in progress. There is lots of regression analysis going on. Then we've got with the mental health, we're particularly interested in mental health. That's a really big policy thing in my country, in the UK. Epidemic of adolescent mental illness going on, and it's really risen. Even before COVID, it was rising, even before COVID, but obviously COVID has really ramped that up. And so it's a massive policy issue. We want to understand that better, and also to predict, crucially, what happens, do people get stressed in their teenage years and then everything's okay, or does it lead to a bad life after that? So that transition after that is going to be really important to understand, but also the early life causes of that. It's not just, we know it's not just poverty, it's much more complicated than that. It's all the adverse events and things going on in between. And anyway, so that's quite an interesting area. And finally, we've got this adulthood model, which takes you, from age, it actually starts at 19, truth be told, but then it does model the transition to the labor market, which is a very crucial period of change in people's lives, and then spits out in the long run. And that's the illustrative example that I'm going to be showing you. That's basically based on the adulthood model, which has been published now. Okay, so that's an overview. So just to sort of explain what we do. So someone else does a trial, right? They've got their trial of an intervention. Imagine it's a welfare advice service for parents of newborn children. What about Singapore's incredibly complicated benefit system. I imagine a welfare advice service would be useful here. What benefits you're entitled to? Are you claiming? Can we sort out some financial problems you might have? That sort of thing. Quite important for parents of newborns, because the first 1,000 days of life are quite important. Imagine we do that intervention and we have an improvement, we improve mother's mental health a bit, and we, a bit more money goes into the household, which might might improve the lives of people. And we get a short-term effect on these things. What's the value of that then? What's the value of that? That's the question. So we take the effect that's measured in the trial. So in this example here, I'm talking about something called the iBerg Child Behavior Inventory Intensity Scale, right? There's all sorts of measures out there. So this is one of them. This was measured at age 5 to 7. Of course, in our model, we've got a different measure. It's the same concept. It's to do with child behavior, but it's a different measure. So we have to do a mapping between their measure and our measure. We take the two together and draw some sort of regression line and map them together. And then we take whatever effect they got in the trial, we plug it into our model. Step 3, crucially, we need to ask ourselves, well, who are we intervening on? What's the baseline population that we're intervening on? Is it exactly the same as in the trial, or is it a bit different? In this case, we're taking information from lots of trials done in lots of different places, and we're assuming the same effects. So we're doing a meta-analysis, right? So we're assuming, and we're applying it to, in this case, it was all children in England, age 5, with signs of antisocial behavior as measured in the screening questionnaire. Okay, but it could be some other population. It could be Wales or Scotland, or I don't know, or a local authority, Tower Hamlets or somewhere in London or whatever. Anyway, so that's our baseline group. And crucially, it's not just the recipients we're modeling, it's the whole general population, because we want to look at the opportunity costs for other people. When you spend money on something, there are opportunity, because this is the great economic, economics 101 insight, that it's not just the effects, it's the costs of things that matter, because that has effects on other people. So we model the whole general population. We see the benefits in the children who get the intervention, and the opportunity costs are borne by everyone because other services are cut. So I'll say a bit more about that later.
Richard, we have an online question.
Oh, great, thank you.
So the question is, why a general measure of well-being was used in this study instead of the EQ5D, for example?
Well, that's because we want to go beyond just health. We're interested in comparing policies across sectors, not just the health sector. It could be education or welfare, all sorts of other social care. So we want a general measure that's comparable. Usually you use money, willingness to pay money. But in this case, we're using well-being. And so, funny enough, in the measure that I quite like, you start with the EQ5D and then you make an additional adjustment for income. But so that's the reason there. But you can spit out health qualities from this. If you're just interested in health, you can do the health as well. That's the nice thing about this model. It's quite flexible. Do keep questions coming out. It's really useful. And then finally, once you've done all this groundwork, then we plug it into our model and spit out, what were the baseline outcomes over the life for this population? Then you do the intervention, and what are the outcomes post-intervention for this population? Then you spin the model several times, you get uncertainty, etc. And then you get your. Also, you have to plug in the initial upfront costs of the intervention. But this model will spit out the savings. Maybe there are savings to the public budget in the long run. And then you can do your economic evaluation. And as I said, at the moment, all we've got is the adulthood model. But in due course, we'll have these other two models so that we can get a much better estimate of outcomes during childhood. So that's basically what we do. And well, in a way, it's back to the question: why are we doing this well-being? Why are we doing this? So money. Oh yes, and I've managed to get a picture of the new note. There we are. King Charles. We haven't seen them yet. They've just been announced. This is a BBC. I copied this from the BBC website. Just been announced what they will look like. He looks a bit younger there, doesn't he? So we'll see them. We'll see them shortly, in the full glory. I don't know. I think there's 2 pictures of him on each note. So that'll be exciting. And I'll be interested to know whether people prefer the Queen or the King notes. I don't know which one's going to be more valuable. Will there be I don't know. Which do you want? But anyway, even using the new King Charles notes, there are problems with financial evaluation. The problems are, firstly, it's biased against the poor and the young. Obviously, £1, 1 vote is great if you've got lots of pounds, or sorry, dollars, right? But not necessarily democratic or fair in a way. It's quite, it's biased towards very rich people because they can vote more. And the other thing is biased against the young because think about it. At the end of your life, you've got a nice house, you've got a lot of wealth. Well, okay, you can give it to your children and so on, but you can't take it with you, right? And so if you're willing to pay your entire wealth for an extra possibility of 3 months extra life, which you are, and right at the end of life, you want that extra time, right? That's kind of unfair because then you're willing to pay this massive amount of money for a tiny chance of a little extra gain of life. Whereas there are people young without the wealth and money who could gain massively from a much cheaper intervention. It's ridiculous, isn't it? It's kind of biased. So it's biased against the poor and the young. And so a well-being measure has an advantage in that respect. At least as a comparison, you can compare them. Secondly, it gives an incomplete picture of the distributional impact. Money is important, but it's not everything. People's financial needs differ, for example, due to disability or other things. And poverty is not the only in childhood. So, it's interesting to look at other, in a way, looking at money only is a little bit Marxist. It's a little bit class, is all that matters in life your class or your money? No, other things matter. Your happiness, your well-being, your health matters, right? So we're trying to move away from either extreme capitalist money, and extreme basically Marxists and capitalists are all about money, right? One way or another. That's not the only thing that matters. Well-being matters as well, and that's the idea here. We focus on the well-being. So that's the third point. There we are. So there's my little pitch for why well-being is important, and various governments around the world are starting to measure well-being as well as money. But both matter, obviously. Oh, yes.
We have another question from the online audience. So I'm just quoting the question. I'm always worried when I hear terms like fair. Who decides what is fair?
Absolutely. No, you're right. You're absolutely right. Everyone, not only does everyone have a different concept of fairness, the same person has several concepts of fairness floating around in their head. Actually, Amartya Sen is quite good on this in his book called The Idea of Justice. And he gives some very nice examples. In fact, it goes back to Aristotle. There's a child with a flute, right? And who gets the flute? Is it the child who made the flute? Is it the child who plays the flute most beautifully, or is it the child from a poor family who kind of would benefit the most from having a flute? And we don't know. All of these different concepts of fairness pull us in different directions. So we don't know, and I don't know. I don't. I'm not going to say this is the right. There's different concepts of fairness that pull us in different directions. All I'm saying is it's useful to measure some of these concepts, some of these inequalities in well-being or in money, or whatever it is, depending on what the policymaker decides. So to be honest, I'm a little bit of a sort of civil servant type approach, where the policymaker will tell us what they think is fairness, what they're concerned about, and we will model it. But we don't have views. I'm an analyst. I'm a humble economist. I will take whatever concept of equality matters to the decision maker that I'm serving, as long as it's not completely against my own values, right? But yeah, that's a really good point. And anyway, you still might want to look at well-being, even if you don't care about fairness at all. If you just want to know the average, it might be better to know the average well-being effect than to know the average money effect, maybe. Okay. Yeah, and so that's what we do. We take these short-term effects, we simulate a whole range of long-term effects, and then we summarize. We summarize either using a healthy year, the traditional QALY, or we summarize using a well-being year, which is a year of life in a good state of well-being. And that allows us to do cross-sectoral childhood policy analysis, as I said. So you can just, if you're just interested in the financial effects on the government budget, which is very important, you can tot up those. If you want to know the cost effectiveness in terms of well-being, you can do a cost per well-being year. If you're interested in knowing who should get this policy, this is a fantastic policy, but might be too expensive to give it to everyone universally. How can we target it in the most effective way? And then finally, the fairness thing, if you want, you can look at the inequality impact. You don't have to. If you're not interested in that, that's fine. There's various things you can do with this kind of model. And I've talked about the well-being year a little bit. I mean, so I'll talk about the Treasury approach. So the Treasury approach uses what's called a wellbeing, which is a 1-point improvement in life satisfaction for 1 year. This is on a 0 to 10 scale. And what you have to do to convert that into what I call a well-being year, which is a whole year in a good state of well-being, you just divide by 7. Why do you divide by 7? Well, it's quite simple, really. 3, according to the Treasury, is as bad as death. That's what they say. And 10 is the best possible life. So to move from, my 0 is death, right? So their 3 is my 0. And so basically it takes 7 points, 7 points to get from bad as death to best possible. So that's why 1 well-being is 1/7 of a good of a well-being year or a good year. Nice and simple. It all adds up. But then obviously there's a whole. I'm sure there's a whole industry of people out there who could do better than that, who could work out the complicated ways in which this doesn't actually map onto people's real well-being. So this is just a crude starting point, and you could do better than this, I'm sure. So that's what we're going to do. And shall I get onto my example if there's no other questions at this stage? Fine. Okay. So let's get to the example. So we evaluated parent training program for parents of 5-year-old children screened at high risk for conduct disorder. Thing called the Strengths and Difficulties questionnaire. And if you have a score of 4 or above, if the child has a score of 4 or above, they get offered. The parents get offered, this program where you get 20 weekly parenting classes, just 2 hours, called the Incredible Years program. It's a very standard thing, which has been trialed in loads of different places. Costs just over £2,500 UK pounds. So what, three and a bit thousand Singapore dollars per parent receiving it. And we estimated that among our 100,000 cohort, 100,000 general population cohort, you'd get just under 10,000 child recipients. And the comparator is just not getting anything at all. Of course, in reality, some people would pay for it privately, maybe, but we're assuming, everyone eligible takes it versus no one gets it. And then you could do sensitivity around those assumptions. We take our data from, someone else did this meta-analysis of loads of different studies in high-income countries. There we are. This is a classic sort of finding. If you work in this literature, 0.46 standard deviation increase in some measure or other. That's absolutely, standard kind of number. Then what does that mean? If I'm in the Treasury or the Finance Ministry, how much am I willing to pay of government money to get that benefit? I don't know. Do you know what I mean? So that's why we want to do a bit of modeling to find out what that gets us in the long run of someone's life. So we take that and we map it onto our measure, which is SDQ conduct score. We did a very simple mapping. We literally took the effect size and assumed one effect size is the same for both measures, which is probably roughly right. You could get a sample of people who've filled out both questionnaires and do a regression and so on. But anyway, that's what we did. And it translates into what, a 0.09 point improvement in the parental impact score and a 0.7 point improvement in the parent reported SDQ conduct score. So we plug that into our model. And we also, there's a bit of heterogeneity. So children with a higher baseline problem got a slightly larger percentage improvement, interestingly. So we plugged that effect in as well, spin the wheels. And we also allowed for fade out of the effect over time. And there was some natural fade out as well, as I'll show you in a minute. And then we put a bit of randomness as well. We didn't just, we would not fully, it's not deterministic, it's a stochastic thing. So I'm tempted to stand up and point, actually, if I may, forgive me. So basically, this is the child recipient, so 9 and a bit thousand children. This is their conduct. This is just the percentage of cases. So conduct disorder happens if you have a certain score on this conduct scale and the parental impact. It has an impact on their life. And so basically what you see, age 3 is there, sort of 27 odd percent. It then goes up a bit. This is natural. This is without intervention. The solid line is without the intervention. And then it naturally goes down. Can anyone guess why why would it suddenly go up and then down again? What's going on at age 5? Yeah, that's an interesting thing that happens. Basically, I think there's a sort of worried parent effect. Kids look as though they're behaving badly, right? And then actually, oh, it's all right. By the time then they get to 7, it all calms down. So there's a lot of worried parent effect going on here. So we get some natural reduction in the measures problems. Screaming toddlers become reasonably well-behaved school children, or maybe it's the school, maybe going to school. Yeah, I don't know. That's an interesting study in itself. I don't really know. But anyway, when you apply the effect, it pulls people down quite a lot. It reduces the cases by, a good 10 percentage points. But then there's this natural fade out. So pretty soon, the improvement is only 5 percentage points. And that sort of, in our modeling, that persists there. And we do other sensitivity on this fading out more quickly and so on. So that's just the average effect. But anyway, there's still a benefit. There's still a reasonable sized benefit in the number of cases of conduct disorder prevented. Although in the whole population, this is when you map it onto the whole population, it's quite small, but it adds up. It adds up. Quite a few cases, quite a few children don't have conduct problems, and then that affects their whole life, because obviously conduct problems can lead you to worse things and then going to prison and quite a bad life. So when you then map the whole life, you get all these amazing savings, right? I mean, it breaks even pretty soon. It breaks even by about age 15 or so. The break-even point is you see the dotted horizontal lines? So this is the break-even point. That's when you're paying back your investment. So, between age 15 to 25, you're breaking even. But then afterwards, look at that, boom, prison costs particularly. You're really, if you take a long-term perspective, you're making a massive saving here. Although, of course, most policymakers, certainly in, countries like my own, they've got about a maximum 3 or 4 year time horizon because they're thinking about the next election. So unfortunately, there is short-termism built into policymaking. But for that, maybe in Singapore, people can take a long-term perspective. If you've got a party that's been in power so long, maybe you can take a nice long-term perspective and worry about what's going to be happening in the next 10, 20, 30, 40 years of a country. So this kind of modeling can help people who are interested in the long term can get some insights from this kind of modeling. And then, you can tot up how many years. Sorry, my things. Forgive me, Zoom people. My microphone just fell off. I'll reposition it. But on this graph, you can see, how many years you've saved. Years being in prison, or years, with a heart condition, or I don't know what else we've calculated. Number of university graduates, working years in unemployment. It wasn't CVD. It was years. We could have years with mental illness. We could have calculated the CVD. Basically, yeah, and numbers of deaths, etc. So you can, if depending on which policy sector you're in, you can get some numbers that will be interesting to you. And then, that's the sort of, I call these the specific, policy, the sector specific outcomes. But then if we want to make value for money comparisons across sectors, we need to look at well-being. So here we're using good years gain. This is my well-being measure, where it's basically a health quality adjusted for income. So it's kind of a measure of well-being. A score of 1 means it's a year in full health with a good income, with an average UK income. That's a good year, and then it goes up and down from that. Now, the interesting thing here is this is the people who gain. This is the number of good or well-being years that different people gain. Some people gain 10 well-being years, and some people gain much less than that. In fact, most recipients gain a lot, gain not much. They gain a little bit and then it fades out. But some people, look at that, their whole lives are turned around, 5 or 10 years or 10 plus years of extra good life. I mean, that's nice. It's a lot of good life to have. And then the question is, who are these people? Who are the ones who gain a lot? If we could predict who these people are, we can really target this intervention more effectively. So that's when we do the policy targeting analysis. So we run a regression, what are the characteristics of the kids who gain the most? And we work out that it's people certainly with a higher baseline problem score, also in poverty. And interestingly, another thing is with a relatively educated parent. And I'm just speculating here, maybe that's because more educated, if the parents got higher cognitive and social skills, they're more able to take on the training and do something about it. Whereas if a parent is a bit more dysfunctional or less educated, or whatever it is, it might not be the education per se, it might be the education as a signal of how competent, as it were, the parent is. A good parent, a good parent with extra training will gain more than a parent who's got problem. Imagine a parent's like on drugs or something and won't be able to respond to the training, right? That's the thought there. But anyway, then you can run different scenarios. Who would you target this to? If you're like in England, the situation is that local authorities pay for this sort of thing, and they have been cut to the bone over the last 10, 15 years. They can't even empty the dustbins, which is a statutory duty, let alone do this sort of thing. This is like additional social care beyond their statutory duty. So imagine they've got a really tight budget, but they still want to do some of this. Where would they spend it? And if they've got a tiny budget, we'd suggest targeting to this lot, and so on. So we can give advice as to how you spend your tight budget. So that's the policy targeting. And here's the bit that I like, the distributional stuff. So this is thank you.
What is the definition of payback period, payback years on the previous slide?
Payback years? You mean here?
No. Like the slide you just talked about, that one, the payback.
Oh, sorry. That's when you recover your initial investment of £2,500 UK pounds. In terms of savings from the budget, savings from spending less on healthcare and social care. The children with conduct disorder can be quite expensive. They can have emergency admissions. They can need special social care. They can have contact with the police. That's expensive. Although the problem, I say payback. It's payback to different budgets of different. So it's not a real payback to one decision maker. But so you could calculate the payback to a sector specific. If you were the I don't know, the social care budget holder, you could just focus on your social care budget, and then it will take a bit longer. Or if you're the work and pensions ministry, you could focus on the cash savings to, there are savings in terms of benefits to parents. Anyway, yeah, it depends on your sector. But this was the social perspective, put it that way. Yeah, and look, I mean, the numbers add up to quite large numbers over a lifetime. We haven't discounted this, by the way. I'm being a bit naughty. I haven't discounted that. If you discount that, it can reduce a lot. And so distributional impact, you can do distributions by whatever social variable you care about. Here we've just taken the predicted well-being percentile. So you take a child and you know their circumstances, their income, cognitive skills, whatever else you know about them, and you can predict how their life will evolve. And that's their current level, that's their baseline level of well-being. And then you rank them from 0 to 100. This is the worst off people in society and the best off. And then and these are the gains. Oh, sorry. This is the level of lifetime. This is your predicted level of lifetime well-being, right? And these are the gains from this policy. So you can see the gains, the well-being gains, and they're kind of small over a general population. This is 0.2 of a good year. So quite, on average, it's quite small for the whole general population, but you can see the gains are higher among the poor, among the worse off. So you're reducing inequality in well-being. But you could measure this by whatever social criteria you care about. You could do an inequality analysis. This is just an example. So that's the inequality stuff. And the thought is, I mean, this, the moment this life simulation methods are at this stage, the clunky mainframe computer, it takes quite a long time for us to build these models and spin the wheel and do things. But the hope is to get the models into a good shape where you can kind of, shove it on your phone and put in your policy scenario and push the button and get some results reasonably quickly and comfortably. That's the dream. We're not there yet by any means. We're still here. We're still, with the magnetic tapes and so on. But, the hope is this can become a bit more routine as a way of doing economic evaluation in this area.